Good evening, ladies and gentlemen, and welcome to this session this evening. Thank you for finding time to discuss with us this very important topic. Thank you, Mr. Indimuli, for your insights and for your words of encouragement. I will quickly go through some ideas around health and safety preparation that we need to think about as we are considering our schools that shall reopen. Like mentioned, my name is Dr. Njoki Fernandes. My background is medicine. I'm a gynecologist, but now I'm healthcare consultant. So I just wanted to go through a few things so that we understand how we are able to tackle coronavirus as well as other infections that affect us while we are in school. And then we go through the school healthcare recommendations by WHO, CDC, MOH, and the Ministry of Education. And then we go through a bit the COVID-19 situation in the country at the moment and how we shall, we can plan to resume, what preparedness we need to think about when we're thinking about resuming our studies in a few weeks. So we know that COVID-19 is a droplet infection, and it is spread by aerosols in the air. So we spread COVID by breathing, by speaking, by shouting or singing, and by coughing and sneezing. And these are activities that happen when we're in school, when we're in class teaching, and when we are in the field playing, when we are in the chapel praying or singing. These are activities that we do. So the school environment then becomes a place where COVID-19 can spread very easily. And we need to be cognizant of that fact and to think that the best way to stop the infection of COVID-19 is to stop the droplets or the aerosols that are in the air from moving from one person to the other. So what does the WHO and the CDC and the Ministry of Education and Ministry of Health recommend? They recommend that you have a face mask for everybody all the time. Now, this face mask needs to be worn correctly, and it needs to be of high quality with a high quality thread count and worn correctly over the face and over the mouth. It needs to be comfortable, that it can be worn the whole day. One of the challenges that we have seen in schools as we have done our work is that the children have face masks, yes, but they're not on the face and on the mouth. They're wearing them on the chin or on the forehead or hanging somewhere. Yeah, and the face mask should be worn at all time, except when you're having your meal, in which time social distance should be encouraged as much as possible. We are also told that we need numerous multiple water points to enable hand washing, and then plenty of soap and alcohol-based sanitizer as much as possible. It's not always possible for students, but for staff, for teachers and non-teaching staff, we can provide them with alcohol-based sanitizer. And then frequent non-touch temperature monitoring. Many schools are doing the non-touch temperature monitoring, but there is another step. You need to record the temperature and do something about it. If a child comes to school with a temperature of 39 degrees, what do you do with that information? Yeah, just noting that they have a temperature of 39 doesn't help the situation. It negates the purpose for which we are taking the temperature in the first place. Do you have a strategy for keeping the child aside and then taking the temperature after a few minutes, then deciding what to do with the child? That's in the morning. If it's after lunch and you've been playing in the sun and you take a temperature and it's high, what do you do? Yeah, so this frequent temperature monitoring is just not about taking a reading. You need to do something about the reading that you find. And then social distancing is a recommendation, but it's not very practical. We grappled with that before we opened schools in October, and we realized that yes, we will not be able to social distance because we have limited infrastructure, but how can we work around the space that we have to make sure that as much as possible, the children are not crowded, especially during meals or when they're going to the washrooms or when they're using the library, laboratory, things like that, as much as possible. Ventilation we can do to increase the ventilation in our premises, the classrooms, the dormitories, the dining halls, and the chapel, to make sure that the windows are always open and that the air is circulating. And then finally, the sanatoriums or health facilities. This is a recommendation by the Ministry of Education, manned by qualified staff who can review, diagnose, and treat on site. And we're reviewing acute illnesses, chronic illnesses, and emergencies. In medicine, we have what we call the golden hour. If a child collapses, you have an hour within which to rescue that situation. And if you do not have somebody qualified enough to make a diagnosis as to why the child has collapsed, and then you're calling the principal who is not available because he's in a meeting or his phone is off for whatever reason, you're looking for transport, that waste of time, you can actually lose a child in a condition that is treatable, yeah, because you don't have somebody to diagnose and to treat, initiate treatment on site, yeah, refer when appropriate, and provide appropriate transport for referral. If a child is not breathing and you have made a diagnosis of a severe asthmatic attack and you have given them the necessary treatment on site and you need to transport that child to hospital, you don't put them in the back of the principal's cab, because really then they cannot breathe, they will not reach where they're going. So you need to provide that ambulance that is an acute life support ambulance that can have respiratory mechanism to breathe for the child and things like that. These are the school healthcare recommendations. So our current reality is that May 10th, we are going back to school. And as Mr. Ndimuli has said, we are opening schools within the third wave. Yeah, our beloved cabinet secretary has said we are going back to school. The calendar is not changing. And in case you're wondering what the third wave is, I have illustrated it for you here. The first wave was when school closed the first time. Then this is the second wave that happened in November when we were at home. No, okay, well, Form 4s were in school. And then this is the third wave that we're currently experiencing. So schools are opening in the next few weeks within this third wave. And so we need to think, what does that mean? It means that because the infections are still high, as of yesterday, we were, was it 18% or 16%? It means there's a lot of community transmission happening. And therefore, it means that our children will come to school possibly with COVID, or they're coming from homes that possibly have COVID in the environment. And because we're not going to test them, how do we then manage this situation? Yeah. And so we've talked about the government guidelines. But we need to think, each of us in our school, what is our level of preparedness to implement the government guidelines? The implementation is variable depending on each school's personal initiative. Really, it's up to each of us to see how to implement these things. Each school does it its own way. You've heard how Matako School went out of their way to think about how to sort out the situation in their school. The masks are a bit of a problem because students are being asked to come with masks, and they're coming with whatever mask that they can get their hands on. And if the mask is not a good barrier, then we have a problem. And then the hand washing points have been increased in many of the schools with soap. There's a good effort, but to constantly supply that water and to make sure that the hands are being washed. You know, you can have water points, but the hands are not being washed. Yeah, that's another challenge. Yeah. So our heritage solution, like Mr. Ndimuli has talked about, it's a service that includes healthcare provision, wellness programs. This was interesting because we discovered that when the children came home from a very long closure, they had mental health challenges. And by mental health, I mean, many were anxious, many were depressed, many had picked up habits along the way that were not what they would have been doing if they were in school because of idleness. Many had gotten into alcohol addiction, drug addiction, pornography, gaming, a lot of internet use because they were using the gadgets for their studies, social behaviors. And many of the parents had been laid off work. There had been a lot of anxiety in the home. And so when children came to school, this anxiety and these mental issues played out as they were learning, and it became a challenge. So in some of the schools, we have counselors who come on site and talk to these children one-on-one to really help them get back into the rhythm of school, and to encourage them to follow the government protocols like have been mentioned, and the infrastructure that Mr. Ndimuli has mentioned, so I will not go into that. Yeah, so we've talked about the fully equipped and staffed medical facility. On the right here, we can see our facility. We got an impromptu visitor one day in Machakos. The cabinet secretary came to pay us a visit. And so here you can see him with our staff, the nurse and the clinical officer. And this is our isolation unit, which thank God, we never got to use, but it was fully fitted and ready. And he has also explained what we are doing with the staff complement and how we manage them. We manage them at a consultant level, so that even these children, as they're being treated, they're being managed externally. We know what's going on, and we collaborate with the staff on the ground. Yeah. And then the mask that we talked about, we went ahead because of the challenge of masking to design a mask that was designed according to the CDC guidelines and approved by the Kenya Bureau of Standards. It is 3 layers with a filter and branded accordingly and adjustable for a comfortable fit. So it can go behind the head or behind the ears as you so wish. And we are happy to say that the schools that used this were happy, and they think that it helped with the spread of COVID in their schools. This we have gone through. This is a containerized outpatient facility for those schools who feel they don't have space to do a good facility for their clinics. This was designed by Mr. Ndimuli, and so it has got lab and pharmacy, triage, washrooms, and a place for the doctor to see the patient, and a place for the patient to rest in case they've been given some medication, we are observing, whatever. So these are 2 20-foot containers. Then an isolation facility, because there's some people who do not have space for isolation, and in case of COVID-19 or in case of another infectious disease, chickenpox, or they have a very bad flu and you don't want them to mix with the rest of the students, they can have this facility. And outside here is where the food is given to them. And like he said, the 4-bed facility with bathroom and toilet. And this is for the nurse who accompanies the patients all the time. So the benefits of this healthcare system, which we need to think about, are that it's costing and time efficient. We know that it's disruptive for parents to come and keep collecting their children to take them to school. It's also disruptive for the school administration to keep taking these students to the healthcare facility, and it disrupts your activity. Yeah, so it saves you on time and it's cost efficient. So by the time the child is going to school, they really, really need to be there. And then we saw that that child who was sick and did his KCSE in school, it would have disrupted him because you'd have had to have his exam in Machakos level 5, which would have been disruptive, and it's not a conducive environment for doing exams. Peace of mind, yeah, for parents and school administration, that our children are looked after, not only for COVID, but any other acute and chronic illness that they might have. And then we offer quality healthcare, yeah, which is standardized. You know, unfortunately, there are some children who, because of their background, have medical cover, others don't have. So when they come to school, there's a bit of inequality, but we offer standardized healthcare for all students, regardless of personal circumstances. And we also follow the Ministry of Health guidelines that have been approved. So I think I'll leave it there for now, and we can engage with questions as we go along. Thank you.